Welcome you to the second segment of Inside the News on WinFM 90.9. Good afternoon as well to our sister stations who are taking the feed from us today. And we say a very good afternoon to the cable, management and staff.
As social distancing becomes the norm of our everyday life, the cable wants you, our customer, to know that we are here for you every day. Just log into us on Facebook, Instagram, and YouTube. Send us your feedback at email customerservice@thecable.biz. Visit our website www.thecable.net. It's also nice to know you can pay your bills at a distance, online at all commercial banks, or at www.thecable.net/pay. Now's the time to try online banking. It's ultra easy. Call us at 465-2588, 662-7742, or 763-04. The Cable. We're here for you.
Once again, a very good afternoon to you. You are listening to Inside the FM 90.9, www.winnfm.com. We're very happy to have with us today the Prime Minister of St. Kitts and Nevis, Dr. Timothy Harris, as well as the Medical Chief of Staff, Dr. Cameron Wilkinson. We're going to go to the Prime Minister for some comments as we resume Inside the News. We'll take your calls in just a minute or so. Prime Minister, good afternoon. Yes, good afternoon, Prime Minister.
Could you repeat that?
Yes, sir. Good afternoon to you. I was just saying just a moment ago that in our second segment, we'll just begin for a quick...
you have a mic issue.
All right. So, okay, let's start it off in a minute. All right, we do apologize for that, and we apologize to the Prime Minister. We keep mixing up the Prime Minister's headphones. We have to stop it. So, Mr. Prime Minister, once again, our apology, and let us continue now. We have it ready now, and as we said earlier on, what we do in the second segment is have a few comments from the Prime Minister who wanted to clarify a few things, and then we're going to take your phone calls in just about a few minutes from now. So, Mr. Prime Minister, once again, we apologize, and we now continue on Inside the News.
Thank you very much. I just wanted to add to the remarks on the state of the readiness of the health system to say when we say in St. Kitts and Nevis we are at the best place, that include the health sector as a whole, and we are taking the Federation, the island of Nevis, the island of St. Kitts, and it is a sum total of our joint efforts that would put us in the best place. So when we say we have improved upon the capacity of the human resource in the health sector, we have brought in expertise. That expertise is made available on island in St. Kitts, on island in Nevis. Similarly, with respect to protective equipment and other medical supplies, when they do come to the Federation, we ensure that they are distributed not only on St. Kitts, but importantly on Nevis, whether it is ventilator or other items of support. So it's a joint effort. And as we commend the workers on the island of Nevis, equally we are commending the professional workers at the forefront at the Alexander Hospital in Nevis and in the health system as a whole. So commendation to all our police officers, our immigration workers. So I just want it to be clear that we are looking as a federal entity in terms of when we adjudge the readiness and the performance of the sectors. So none should feel left out.
And I just want to interject here as it relates to the ventilators also, because sometimes when we hear the absolute numbers, we don't think about it per capita. So, for example, in St. Kitts, I said we have 15 ventilators, and Nevis has 4 ventilators. Now, if we compare ourselves to the United States, on average per state, they have 19.5 ventilators per 100,000 population. Some states have less, some states have more, but you've been hearing a number of states crying out saying that they did not have enough ventilators. If we look at our figures per 100,000, Nevis, with a population just about 10,000 or more, they have 40 ventilators per 100,000. St. Kitts has 37 ventilators per 100,000, which puts us in a good place.
Thank you very much, Prime Minister Harris, and thank you very much, Medical Chief of Staff, Dr. Cameron Wilkinson. I just want to throw some numbers out there before we go to the phone lines and just establish some ground rules for us today. We'll ask our callers to limit their contribution to just a minute in the first instance, and we'll give you a chance to call back again if you so please. And of course, I will exercise my privilege as the moderator to decide that, we get the point and we'll move on. So that will come up in just a while, just so you can get a sense of what's happening. I just took during the break. In the U.S., there are now over 500,000 cases confirmed and over 19,000 deaths. And the U.S. now stands at number one in the world. And not the kind of statistic that the U.S. would want to have, but it's at number one in the world in terms of confirmed cases. It is now the epicenter of the coronavirus COVID-19. Spain is at number 2, Italy number 3. Italy is not number 2, sorry. Spain at number 3, France at number 4. The UK now has 78,000, almost 79,000 cases with over 9,000 deaths, closer to 10,000 deaths at the moment. Taiwan has 385 confirmed cases with just 6 deaths. In the Caribbean, Cuba has 620 confirmed cases, 16 deaths. Guadeloupe, 143 confirmed cases, 8 deaths. In the Eastern Caribbean, Antigua and Barbuda has 21 cases. We have Dominica with 16 cases, and in Antigua and Barbuda we've had 2 deaths. Dominica, 16 cases, no death. Thankfully, St. Lucia, 15 cases, no death. Grenada, 14 cases, no death. St. Vincent and Grenadines now has 12 cases. And of course, you learned yesterday that St. Kitts and Nevis has 12 cases. And we heard from the medical authorities that so far, the patients are responding well. No one has been hospitalized, but they're certainly in isolation. So just a sense that we're dealing with a very serious issue, not to be taken for granted. In the larger Caribbean, Jamaica, 65 cases. Guyana, 40 cases, and Jamaica's had 4 deaths. Guyana's had 6 deaths so far. The Bahamas, 42 cases, 8 deaths. Trinidad and Tobago, 109 confirmed cases and 8 deaths. And these figures keep changing all the time. If you go back later on today, you'll see other numbers. So we are indeed facing a huge challenge not to be underestimated, not to be taken for granted. Having said that, we now open the phone lines. Our numbers are 466-0989, 662-0989, 762-0989. We have a question for the Prime Minister, a question for the Medical Chief of Staff. This is a good time to give us a call. Let's go to the phone lines. Remember, I'm going to give you a minute in the first instance, so you need to get to the point. Short and sweet, as we would like to say. A very good afternoon to you. You're live and on the air.
Good afternoon to you, Mr. Bacchus, and good afternoon to the Prime Minister and Dr. Wilkinson.
Good afternoon, sir.
Good afternoon.
Blessed Easter to you all. Now, I have a concern, which would be my question to Dr. Wilkinson. Okay? We are told to, if we are going outside, to wear masks, right? Okay, now, wearing the mask, most people, if not all, would have that mask on for the entire day, right? And they're putting their own droplets into the mask. Also, probably will be receiving droplets in the mask also from others, because by wearing the mask, people think that they could be closer to each other, not staying away the distance that they are asked to because they have on the mask. So, and then we're told that the virus can stay alive on surfaces for a few hours. So my thing is, if that is so, by me putting in droplets into my mask, receiving droplets in my mask from other people, isn't that a possibility for people to get infected, or maybe infect other people by putting on the mask, and then we have on the mask for the entire day? If we are outside, the same mask, we're not changing the mask, the same mask, and the virus, you can say that, lives in and stuff for a long time. So that is my question to you all.
Thank you very much. We go to Dr. Wilkinson. Doc?
Oh, we answering right away?
Yes. At the moment, you only have this caller. Everybody has perhaps understood everything you've said earlier. So we go to Dr. Wilkinson.
Okay. So this is a virus that we are learning about as we move along daily, and the guidelines have been changing. Now, the CDC has now recommended that persons should wear a mask when they are in public. What you need to understand, though, when you're wearing the mask is to protect people around you if you are infected. But you being protected from other persons, the main focus is on the social distancing, maintaining your 6 feet distance from other persons. Therefore, having a mask is not an excuse for you to be close to someone. And that is the point that we need to drive home to persons. Now, the mask that you're using in the general public, it doesn't necessarily have to be a surgical mask or an N95 mask that is reserved for healthcare workers who are in direct contact with persons who are infected, because these are the masks that are designed to filter out organisms to prevent them from getting infected by another person. But your mask that you're wearing in public is to contain your secretions so that you don't infect someone else. But you need to take the personal responsibility in separating yourself from persons in the public so you don't get too close to get infected by them.
Thank you, Dr. Wilkinson. Back to the phone lines. Okay, we seem to have waited a bit too long. Caller, do give us a call, 466-0989, 662-0989, 762-0989. Overseas numbers are 718-285-6984, 718-285-6984, 305-921-4619, 305-921-4619. And we go back to the phone lines now. We hear from this caller. Call you live and on the air, and good afternoon to you.
President, good afternoon, Mr. Backus.
Yes, sir. Good afternoon to you, sir.
Yeah, this is Ras Kolonji.
Yes, Ras.
I would just like to hear up the doctor there, Mr. Wilkinson, and the Prime Minister. My basic premise is that this is biological warfare. Not only raging on our people, but it was released in Wuhan in China. You know that China is going to be the economic powerhouse of the world. And in my estimation, when they're releasing this virus in China, just give them the go-ahead to be, even though they was trying to delay China coming to the fore in terms of being the economic powerhouse. Yeah, give them the light now to move forward, because you see what is happening in the United States. Now, in the United States, now you realize that they are saying that our people, African American in particular, is most affected by this virus. Now, what we have to realize is that this is nothing new in terms of African people in the United States, or even throughout the world, because we could recall the Tuskegee experiment. Now, the reason why African Americans is more affected is because of their living conditions. They are a poor segment of the population in the United States. So, what our people have to realize is that coming out of this pandemic, because pandemic means worldwide, we have to adopt a culture of Pan-Africanism, that we have to look in terms of this, in what is in the interest of our people. You understand? Because we have seen where Donald Trump has said this is a Chinese virus. Now, they also said that the reason why Haiti is poor is because they believe in voodoo. Every time they do something, they try to blame somebody else when they are the real culprit. So I'm saying to our people and to the Prime Minister and to the doctor there that we have to do everything possible, that we could in order to save our people and work and respect one another in this pandemic that is taking place. So I'm saying there's no reason why we should be pointing finger at one another, because the system is designed to divide and rule. Now, when you look at the whole situation taking place around the world, is that, as Malcolm said one time, that when they kill Lumumba and then they kill President Kennedy, the chicken come home to roost. That's all that is taking place. So I'm saying to our people that coming out of this pandemic, we have to unite as one people.
Okay, Ras, thank you very much. I think we get the gist of what you're saying. We get the point, and we want to thank you so much for your contribution. The phone lines are quiet at the moment. Let me put this question as well to the Prime Minister and Dr. Wilkinson. Now, I've got someone asking me this question. When you have the lockdown and then you open up for 2 days for people to do some shopping, some people are in the line for quite some time, some as long as 2, 3, 4, 5 hours, and then supermarkets are asking them to just spend 15 minutes in there, and they're trying to shop for a few days, so sometimes that doesn't work out. The other issue has to do with essentials. Well, the questions are coming fast. The other issue has to do with essential workers and the fact that they seem to be competing sometimes with the regular lines, and that's posing some complaints of whether or not another system may be considered. And the final one is whether or not, even though it's a work in progress, if the government is thinking of perhaps having more zones, rather than just 2 zones, perhaps 4 zones, and rather than just 2 days, perhaps 3 days. There's another phone call coming in. We go back to the 4 lines. Call you live and on the air. Okay, we missed that, so we're going to go to the Prime Minister and Dr. Wilkinson for responses.
Thanks. There is no template for this pandemic, and no one has, as it were, the silver bullet to deal with the challenges socioeconomic that have developed as a result of the pandemic. So we learn as we go, and that is why the government's policy has been very agile, very flexible. For example, over the last 2 days that we had the partial curfew, we began the process of zoning. The security forces, the chamber and others have had that experience. We expect as we move forward, modifications may come, some tweaking may come, so that we get better towards perfection and, more realistically, a better system. I think what is required in all of these, because these systems in large measure has an element of honor, that you expect people to abide by the rules. If you say persons in East Zone or East Side only, you do not expect that on the next day, when it should be West Side, you have persons from East Side going back into the line. That itself creates a problem, and that itself shows our callousness, because we are attempting to minimize the many opportunities in which people are in group. That is why the regulations are premised on people staying at home for as long as you can. And we continue to say to people at all walks of life and on all levels, minimize your journeys to the supermarkets. Some people go there, they might be able to buy up for 14 days a month. Do that. Don't ever go back until that period that you've set yourself. Because unless you discipline yourself, and it is a learning process, so it will come only through constant practice, then those persons who can should be out of the supermarket and not be competing with others. Similarly, we are saying, buy as much as you can in your communities. Do not leave Mansion and Christchurch and Sadlers to come into town to shop for the very things which are available in your communities. If people were to make those adjustments, then we will have less persons, in fact, in any of the supermarket, creating a challenge for all of us. I believe that the supermarket operators will have to learn as they go and be agile. How, for example, have they evaluated, say, what we call that? You have a few items. How is that particular cashier operating in terms of the delivery of services? We need, again, perhaps to see better management, the lines for the essential workers. When someone appears in a uniform, is there anyone outside, inside? And in fact, you need both outside to be able to quickly identify the police officer, the fireman, give them priority access to the lines. Those are some of the areas that I think that we could better manage. And we certainly are going to have to, in all cases, try to minimize. I would want to see some special attention be paid to persons, shoppers, who are asthmatic and who have under some form of health risk, that there is a line devoted to those people, apart from the elderly, so they too can be fast-tracked. So the short answer to a complex question is that it is a work in progress, and we continue to evaluate the past experience to see how we can improve upon it. But all of us, that is why we say the power lies in you. All of us can do something to help make the shopping much more easy for everyone else and ourselves.
Thank you very much, Mr. Prime Minister. We go back to the phone lines. I come back to Dr. Wilkinson in just a moment. Calling you live and on the air, and good afternoon to you. Thanks for calling. Go ahead, please.
Good
Good afternoon, host.
Good afternoon.
Prime Minister and Dr. Wilkinson.
Good afternoon.
Two quickies. Dr. Wilkinson first. Now that the Cuban health experts, have been released from their isolation, in what way will they be used? Will they be used, you give me greater details, to relieve the existing health staff, or will they be used solely for the fighting of the COVID-19 virus that we are facing? That's one. And Mr. Prime Minister, some days ago, I heard a news item which said that, I think it was that same radio station, that said that the United States government had given the territories some $6 million, which will be managed by the U.S. Embassy in Barbados, which assumed, therefore, it would be covering territory, mean the OECS and Barbados. I just want to know if there's anything that you can tell us about that, such as what would be our allocation for that about the money, and how did they intend for us to use that money? I think it was all in the effort to fight the virus, but was there any specifics assigned to that monies that the public can be made aware of? Thank you.
And thank you very much for your call, sir. We don't have any other call in the line, so I'm going to throw in another question as well. Someone sent me a question asking, I've been told to stay at home, and I'm wondering now whether I should apply for help or whether I'm going to get my salary. I'm not sure. I've just been told to stay at home. This may be a bit of a out in the left field, but let's throw it there anyway.
Well,
so
let me start with...
yes, let's go to Dr. Wilkinson.
Yes. Okay, so I'll start with the last question as it relates to the Cuban experts. Now, they have been released from quarantine, not isolation, so we need to make sure we get the terms correct. Isolation is for someone who was known to have the disease. Quarantine is somebody who we put in a location out of an abundance of caution for the incubation period of the virus. Now, they will be commissioned on Monday, and you ask, how are they going to be used? One of the reasons why we got them is to help us take care of any surge in increased number of patients that we would have had from the COVID-19. I said, however, though, that on both islands, we do not have any patients who are hospitalized as yet. However, they will be deployed in the emergency rooms to help with the screening of patients. And the specialists will be deployed in the intensive care unit and also in the emergency room to help us until, God forbid, we start getting patients. Now, somebody else mentioned earlier about biological warfare. I just want to say with all due respect that that is a myth, and we know that this virus is a virus that jumped from animals to humans, and because of that, our immune system was not prepared to deal with it. And it's not biological warfare designed to attack African Americans. The main reason why African Americans are being affected predominantly more than whites is because of socioeconomic status. You have overcrowding, plus some of them have a number of chronic illnesses, obesity, diabetes, hypertension, that's more prevalent in the African American society. And I believe after this pandemic is over, more attention would need to be paid to these persons to make sure that they can survive something like this.
Thank you, Dr. Wilkinson. Prime Minister?
Well, stay at home is the basis on which the curfew, and all curfews are predicated on that you're staying at home, you're off of the road, you're basically in private places. And it says that you are only expected to move if there is a compelling reason, I'm paraphrasing, for you to get out. Whether or not you are going to stay at home and get money, we are in a real world, and so we know what the real answer is. There are some persons out of the compassionate policies of the government. We've said that if as a result you are displaced, you are earning less income that is verifiable by your employer, then you have the possibility of being qualified to receive a support of $1,000 per month from the Social Security Emergency Fund. Additionally, the government have other safety net programs, and if you are qualified, you can then access them. One of them is the Poverty Alleviation Program. One of the criteria for the poverty alleviation is that your household income must not exceed 3,000. So if now you are one of the breadwinners in the home, you lost your job at Marriott or Coy, for example, that may now bring the income of the household within reach. And in the earlier presentation, opening remarks, I did say we have over 500 applicants online who have now basically been presenting that they are eligible. That process of verification is happening now. The workers at Sustainable Development have been doing their necessary cross-check, and our intention is to get them on the beneficiary list for this month's payment of the PAP. We are also contemplating bringing forward, making an earlier payment with respect to the PAP program. Again, when you look at what we are doing in St. Kitts, and people have to again appreciate we are not in isolation. We are part of the world. In St. Vincent, the best they could offer is $75 per week. And we went through the stats. In Barbados, the best they could offer persons in similar circumstance, $600. In Trinidad and Tobago, the best they could offer, an oil-rich country, 603 EC dollars equivalent. What we have done here is remarkable, and it shows again how well, not just the government, but institutions such as Social Security, how well they have been managed, and the reserve they have accumulated that have allowed them to be able to give such a response. So stay at home because it is the wise thing to do. Stay at home because it ensures that you mitigate the risk for transmission to others. And you stay at home, take care of your family. You'll be surprised at all the wonderful things you can now do while you're staying at home with no reason to go out. The matter to do with the U.S., that is a matter under constant discussion. When I would have completed today, I'm expecting to speak with functionaries at the White House regarding bilateral and other collaboration between us. I should say one of the interesting things that has emerged in this matter to deal with the scarcity of ventilators, St. Kitts and Nevis now has become a state of interest. State of interest because right here in St. Kitts and Nevis, ordinary men and women going about their work at Harrow API, they are the ones that are producing parts for ventilators. And the U.S. government then is reaching out to us and wanting to have a conversation with me later today to see what we can do in the context of our lockdown to provide some space so that those essential parts can be made available for the manufacture of ventilators. You see how interconnected we are. You see how at times we take for granted the work that the ladies and men in our factories are doing. In the context of one of the most significant health challenges, St. Kitts and Nevis has got the attention of the U.S. government because right here, our people from all over the country who are working at Harrow, they are the ones now that they need to help to deal with the shortage. So the geopolitics becomes interesting in ways that we could not have contemplated at a particular moment in time.
Thank you, Mr. Prime Minister. I'm going to go back now to Dr. Wilkinson. Of course, from your explanations, I can paraphrase and say it's basically a question of healthy living, social distancing, clean and disinfect and all that, all part of it, and test, contact trace, quarantine. And you mentioned yesterday that you'll be having some rapid testing introduced. We've heard about rapid testing in the context of being able to move a little closer to normality. Can you explain the importance of rapid testing and, of course, the issue as to what type of rapid testing would you permit? And bearing in mind there was some discussions about Chinese products earlier. Okay,
so the standard test that is used, or the gold standard, is the antigen test, the PCR test, where a sample is taken from the person's nose or mouth, and it is checked for parts of the virus, the viral antigen. But that is a bit time-consuming. And the rapid test was developed, which is an antibody test, because what it's looking for is the proteins or antibodies that are produced by the body when one becomes infected and they mount a response. Now, the first antibody to appear in the blood when one becomes infected is the IgM antibody, and this appears about 3 to 5 days after the person becomes infected. The IgM antibody appears about 3 to 5 weeks after, and this usually indicates immunity. And so if one can test for these proteins or these antibodies with a little drop of blood from a finger stick, you can get a result within 15 minutes. And that's why we say there is a move towards doing these antibody tests. Now, there was a lot of talk about faulty antibody tests coming out of China. What we have to understand, first of all, is that most of these antibody tests and a lot of the personal protective wear, etc., they are made in China. Therefore, we need not label China as an entire country badly. The problem with some of these kits earlier was that they gave a lot of false positive and false negatives. And it was thought that when they were developed testing them on patients who were severely ill and had a very high antibody load. And because of that, when these tests were being used in the general public in other countries, they were getting false negatives, which means that persons were being told that they did not have the antibody when they did. Now, a number of those products have been pulled off the market, and we have new products that are coming on. I hope that answered your question.
Yes, you did. Thank you. We're going to go back to the Prime Minister now. And Mr. Prime Minister, can you speak, well, you've explained the economic stimulus package, but could you direct some remarks to tourist-related industries that are ailing, to use that term at the moment? And when you look ahead, you're not sure. There's a great deal of uncertainty. What would you want to say to people who are basically at the moment not too sure what's ahead? It's a little dark looking ahead, not too sure what tomorrow will bring. And secondly, to the issue of the agriculture sector, something you've expressed some passion about, and you've injected $10 million into that sector. And I've heard from the Director of Agriculture about having some crop that can actually develop rapidly. You know, I think it's called fast crops, if I don't have the right term. Sure. But you're also a former Minister of Agriculture, so you know these issues. Can you speak to us directly about tourist-related industries now uncertain of the future, already are overburdened to some extent because of the passage of time and no income and no revenue? Marriott would be an example. And, of course, the agriculture sector.
Thank you very much. And clearly it is an uncertain world now in which we live, not only for tourism, for agriculture, for everything, for life. Because I keep we are in a new world order where the way we greet has changed suddenly. And we have to adapt, and we will make mistakes in terms of our consistency of effort. But it's a learning process forced upon us in the last couple of weeks or so, and we are getting there, some more rapidly than some. The sooner all of us perfect the new ways of bowing, elbowing, using your feet, the better. And the same uncertainty, and that is the heart of the challenge. Small island states have limited resources, and therefore with that comes a limit with respect to your own ability to maneuver a complex global situation. I want to start with the U.S. because right now we have the tension between the economy and the health system. What should be prioritized? President Trump is clear. We have to get America opening up again, not only because it is natural in a democracy for people to be free to move, and it is natural in our systems of government for mobility to take place. They are enshrined in the Constitution. A man must be free to go here and there. A nation must take its own citizen, etc., etc. With the pandemic now, everything is strange. Stay at home becomes the new norm. But if you are at home, and if the nature of the work is such that fewer people are engaged, then the economy moves into a recession. And that is part of the challenge facing not only the U.S., but all of us. So while we are attempting to deal with a health challenge, we are keeping our eyes. When this challenge, there's an ebb, there's a lowering, we are flattening the curve, how will we shoot out of the box? For St. Kitts and Nevis, we have said we are going to ramp up construction. We already put $30 million for mortgage support. We have already put $5 million for small businesses. But a lot of that can only be activated when we are now in a reduced threat from the COVID-19. So the workers can go on the work site. Right now, the law says that unless it is an emergency in relation to health or security, no exception is given to construction, except, again, emergency plumbing, etc. So we have a plan for the after. And what we want is to get to the end as quickly as possible so that we could begin in a real way to boost the economy. Going specific, we look at what it is the economy is built out on. Tourism, manufacturing, and we spoke to that in relation to Harrow, where our manufacturing sector has over 2,000 plus people employed, significant, about 7-8% of our GDP. Our tourism, significant also. And largely, what is that tourism? Movement of people. To the extent that people can't move, whether by cruise, they are in a lockdown, airlines are in a lockdown, it meant there really is no tourism, no yacht, no cruise, everything is at a standstill. And so for that to happen, we have to get the world at a better place where the fears about travel are minimized. And then we could begin to think again about a tourism, at least in the traditional way in which we know it. People come in and people are making expenditure. Our tourism has long, always been centered upon the success of America. We want a strong U.S. economy to be able to jumpstart our tourism sector. So we want everything to go well in America, because if they sneeze, we certainly will catch the cold and more. And that is part of the interconnectiveness between ourselves. So until we see America begin to turn, there are not going to be any significant movement in tourism within the region. Equally, the second most important market for tourists is Europe. And some countries like St. Lucia, like Barbados, like Antigua, they have a larger visiting population of persons from Europe in contrast to America. Barbados, for example, gets more tourists from Europe. Tobago does. So again, the rebounding of the economy of Europe would assist our tourism plan. European tourists, the second largest pool of visitors to St. Kitts and Nevis. So there we go again, because it is the willingness of persons to come largely unsure to get the experience. We have to ensure that the destinations that are important, that they are revived and put in a position where they can come. Even while, for the new future, we have to look at new areas in which we can engage. If Africa, for example, gets out of this relatively unscathed, are there possibilities for promotion, for diversification? If, as it were, our region will only have ourselves for a while after that, what are we going to do with regional travel that comes to make it more affordable and more efficient? That, again, comes back to the center stage. So that is with respect to the vital economy and the role of tourism. Agriculture, of course, and one of the lessons here is that we have to invest more in commercialization of agriculture. We need more people to be doing agriculture as successful businesses. We need agriculture activity to take place. Backyard gardening is good, but we need commercial farm where technology is being utilized. And so we are getting more output for every input within the soil. In this regard, our livestock sector, we're going to need to reshape that. Part of our response this year is that for the first 6 months, we determined that we will provide the Betical free of cost to every farmer so that they will have no problem in getting their livestock in top shape. Indeed, we have officials or technicians from the Department of Agriculture who is going about pouring the Betical to ensure that it's done. There are some farmers who now say, but we can do it. We will want to do it. And my advice to the Department of Agriculture, where they are responsible farmers, let them take it on to do it. Once you know the number of animals, you can determine the quantity of support that is needed to be given. And we trust them, since it's their livelihood, to be able to do that. We have identified over 100 acres of land to produce quick crops. Those are products, by and large, that can grow and be produced within a short period, within a 3-month window, as part of our initial response to food security. Part of the challenge, yes, is that when you look at the curfew, some of the hours may not allow for that to happen in a ready way. When you look at some of the supplies that farmers may need, they would not be able to access them from suppliers because some of those entities are not open. So there is the inherent tensions, and that is why the sooner we are able to flatten the curve, reduce the rate of transmission in the country, the more easy it is to take the country into normalcy, and those elements that need to be put together can do so. We are going to have, in the short run, to look at our hotels and determine, as it were, national rates. A weekend for some of the more affluent and well-to-do, the doctors like Dr. Wilkinson can go and
absolutely.
so on, and radio personalities like the Bacchuses, they can go enjoy a weekend at Marriott. And in some of the more sophisticated jurisdictions, they always had a plan for locally based movement of people into the facilities to take up some of the slack. And I think greater attention will have to be placed with respect to these facilities. And moving forward again, other alternative uses we are going to have to look to for the stock of property we have now been serving as hotels. They may become residences for other activities as a short-run response.
Caller, thank you for holding. You're live and on air. You're with the Prime Minister of St. Kitts and Nevis and the medical chief of staff. I keep mixing up Dr. Wilkinson's title. But you're live and on air. Good afternoon to you. Thanks for calling and thanks for holding. Go ahead, please.
Yes, good afternoon. I have a question in terms of the mask again, because I've heard Dr. Wilkinson talk about the fact that it's really to protect people from spreading their germs, but I understand also that it's supposed to protect people from catching their germs. And one of the things that I see is that people, they putting on the mask and they're taking it off to talk and then they're putting it back on. Sometimes they're out in public and they're wearing a mask, but then they're going to the supermarket and they take it off. But the truth of the matter is, when you're inside the supermarket, it's even worse for you, because if something is out there, because it is a small environment and it's circulated, then it's easy to catch it. And then another thing again, too, because I heard that there are some people who are making hand sanitizer, and Dr. Lord mentioned that the Bureau of Standards really contacted to see if they could really check on the quality assurance of these things. But I'm wondering about the mask as well, and I'm not talking about cement and clothes, because there are companies who they have standards and stuff. But I'm wondering about these private people who are producing masks. Is there any way that, the government or anything like the Bureau of Standards or whatever is checking on these things to make sure that they're up to a certain standard to protect people? Because really and truly, you're talking about life and death. And I would listen after you. Thank you.
Well, thank you very much. We're going to go to Dr. Wilkinson for a response. Doc?
Okay, well, I just want to reiterate something that I said at the press conference yesterday. And I said that the CDC recommends that people wear a cloth face mask to cover their nose and mouth in the community setting. And this is to protect people around you if you are infected but do not have symptoms. And these cloth face masks should be worn in places where there is a crowd. For example, if you're going to the grocery, the pharmacy, etc. But the most important thing is the social distancing. And so wearing the mask does not eliminate the fact that you have to stay away from someone. Now, these cloth face masks, they can be made cheaply from any household material. And so there is no reason for the Bureau of Standards to look at these cloth face masks, because these are not the surgical masks or the N95 masks that are designed to have a certain filtration capacity or to resist the transmission of water through it, etc. These are masks designed to just capture your respiratory droplets when you cough, sneeze, or talk. But the most important thing is the social distancing. Yes, people have to exercise personal responsibility, and if you have the mask on and you're going to be taking it off to shout to someone, etc., if you go in the supermarket and you're getting close to someone and you're taking the mask off, then that comes down to your own personal responsibility, and the police, the government cannot be there for every single person every single time they break the so-called rules or guidelines that we set up, that we have to let people protect us from this virus. And one of the things I wanted to say, with all of the stuff that the Prime Minister said just now about getting our country back together, you out there are the ones who will determine when we will get this country back together, because if we don't do the social distancing, if we don't do the basic things that are required to control this virus, we would see a significant surge in cases.
Thank you very much, Dr. Wilkinson. All right, we don't have a call. Oh, yes, here comes a call. Let's get this call live and up. Caller, you're on the air, and good afternoon to you.
Good afternoon to everybody.
Yes, Gregory, good afternoon.
In Jesus' name, to you, Mr. Prime Minister, to you, the good doctor, and to you, Mr. Backus, and listeners. Now, I would like to quickly say that I would like to ask a question and then make some comments quickly. Now, first of all, since there's these measures, lockdown, government-enforced lockdown, and social distancing, I believe when things are done, especially that's going to affect people's lives very adversely and negatively, it's supposed to be going on hard facts rather than assumptions. Now, my question is this. What good or hard evidence do we have that government-enforced lockdowns and social distancing result in less people dying from this coronavirus? What evidence do we have of that? You see, because, for example, there are places around the world that are locking down, of course, and there are places that are not really locking down. And there is no general difference between them of people dying of this coronavirus. And not only that, even in the United States, despite of what Dr. Fauci said, President Trump did not issue a national shutdown order. And so you have some states, some areas that are not locking down, doing very little in that area, and others that are doing it very strictly and harshly. For example, Colorado have very strict, harsh shutdown, and they have 193 deaths, whereas South Carolina only have 63 deaths. And what they have done is pretty mild. There is no stay-at-home order. There is no business shutdown order, that sort of stuff. And you only have about a third of the deaths that Colorado had who have very strict lockdown. And there are other states as well. And by the way, both of them population are around 5 million, Colorado and South Carolina. Not only that, but there are other states in the United States that are also, that have not shut down or did very little or mildly in that direction. And yet we see the death rates are very low, like Arkansas, which are 18 deaths. North Dakota, 4 deaths. South Dakota, 6 deaths. Wyoming, who had no lockdown at all, and they have 0 deaths at least on the 9th, from the 9th. So this is why I also asked the question: what evidence do we have that these government-enforced lockdowns and shutdowns are resulting in people dying less from this thing. And lastly, I would like to say very quickly, the former Manitoba in Canada chief provincial public health officer, who is also a professor at the University of Manitoba and director of International Center for Infectious Disease, Dr. Joel Katner. Dr. Joel Katner said that there is no evidence, no strong evidence that social distancing does what is said that it would do in helping to protect you from the coronavirus. He says at best the evidence is very weak in that your social distancing is concerned.
All right, thank you very much. Dr. Wilkinson, all yours.
Yes, okay. Well, we actually have strong scientific evidence that the lockdown works. This virus started in Wuhan, China, and in the very early stages, thousands of persons were getting sick, thousands of persons were dying, and China introduced draconian measures and locked down the city. And we can see that they were able to break the spread of the virus, and now their city is coming back to life. New Zealand also introduced strict lockdown measures, and they are doing quite well. A lot of the cities that were caught unaware and persons came in with the virus and the virus was allowed to spread, they are the ones who are now experiencing significant mortality as it relates to this virus. Now, you have been comparing apples and oranges because you mentioned some states, and some of these are in Middle America where they have wide open country and there's not a significant overcrowding. Therefore, these are countries that did not necessarily have to put a lockdown in place because people were distant already, and the chance of the virus spreading in an area where you have a decreased population density is much less than a city like New York where you have significant overcrowding. And therefore, we need to make sure that we compare things properly. Now, there is scientific evidence that when somebody coughs or sneezes, this virus is expelled in respiratory droplets and can travel a few feet. And that is why the scientific evidence tells us that if you stay at least 6 feet away from someone, the chance of that respiratory droplet getting to you is significantly decreased. And you yourself would have known that if, even before this virus, you would not want somebody to sneeze in your face, because if you were close enough to them and they sneeze in your face, you would feel the droplets coming on your face. And what would you do? You would move back. You would increase your social distance. But now we're telling you, scientifically, you need to stay back 6 feet. And that's all the scientific evidence that we have.
Back to the phone lines we go. Call you live and on the air. Good afternoon.
Hi, good afternoon, gentlemen.
Good afternoon to you.
Good afternoon. Mr. PM, I want to say thank you very much for wearing your mask. I cannot see you, but the way you sound, it appears as if you're wearing a mask.
I am.
Thank you for leading by example. I am telling you this because you know what, you don't.
We can't hear you. Are you wearing a mask as well?
Wait. Because you don't, Mr. PM, you put on your mask because you don't want to damage anybody else who may not have it. And so therefore, that's when you get back to the state program. I believe, because we don't know who have it. We don't even know if we have it. We, each and everyone, should practice wearing the mask. The thing is, social distancing is good. But our lungs are very powerful when we shout. Things come from way down. They call them golf ball. And your nose is like a suction, a vacuum cleaner that sucks in things. And so when it gets down and it gets trapped in your lungs, then you have it because you was not wearing a mask to protect yourself. So in my view, everyone should act as if they have it and don't want to give it to somebody else. And so even though you have social distances, which is good, sometimes you might be passing somebody and the person may be speaking to somebody else, not even to you. And the golf ball, or you call it droplet, will drop in their mouth or their nose or something. The vacuum cleaner might pull it in, and so therefore they might end up with it. So to me, thank you, Mr. Payne, for leading by example. Doctor, let us wear the mask. Thank you very much. Have a good day.
And thank you very much for your contribution. Two questions now for Dr. Wilkinson. We'll get this question. We know, of course, of the shortage of tests worldwide. The question is, can you predict at this time when people will be able to access tests? Those who just want to know, not that they have a symptom or what, they just want to know so they can, begin something. How soon will that you predict may be available to any citizen saying, I want to test? So that's one question. The other question is to do with the Prime Minister. With all the information that you're sharing, Prime Minister, how do you keep spirits up? How do you keep people from not being overwhelmed? You try not to overwhelm the healthcare system, but with the economic realities, with the closeness of this thing, how do you, as the leader of the country, how do you do your best to keep people with that sense of, for want of a better term, optimism in the middle of the crisis? Dr. Wilkinson?
Okay, so in the perfect world, the best thing would be to test the entire population of St. Kitts and Nevis, and we identify who is positive, we isolate them, and in that way we'll be able to eliminate the virus. But that is not possible. The antigen test is expensive and is not done widely in a lot of countries. Where we are moving towards is the antibody test, which is rapid and cheaper. Now, one of the things that we are doing as we embark upon the use of the antibody test here, we are going to be starting out with the kits that we are using to do a backup test with the antibody test, with the antigen test. Now, once we've confirmed that there is significant positive correlation between the antigen test, which is the gold standard, and the rapid antibody test, then we can start doing more of this in the general public. And in that way, persons who just want to be tested can be tested. But for now, there's a prioritization as to who we test. And there is no reason for us to be doing the test on persons who have no risk at all since they're in shortage.
And before I go to the Prime Minister, just a follow-up question. Even as you try to deal with suppressing transmission, we're seeing reports that suggest in some countries you've had a sort of a resurgence. The borders were closed, and you had a dropping off of the numbers, and then you had cluster communities that developed problems. From your analysis, Dr. Wilkinson, are you looking at the possibility of potential cluster areas where perhaps in that group there may prove a problem? Are you seeing that?
Yeah, well, right now in our country, we don't have any clusters to say. But as it relates to the virus and reinfection and resurgence, one of the things that I said is one can recover clinically and your antigen test can be negative because your viral load has dropped so significantly low that the test doesn't pick it up. But if your immune system drops, the virus can start multiplying again, and you can appear to be having a second infection. And it's important for us, even after this, to maintain the social distancing, etc. As a matter of fact, one of the things that one of the top U.S. Health officials said, that he believed that handshaking should be the thing of the past. And so there are certain things going forward we're going to have to do, and we'll see that it will not only just protect us as it relates to the coronavirus, but in terms of reducing the incidence of the seasonal flu, etc. And even from the lockdowns, etc., that we've been having around the country, the atmosphere itself is improving. I saw today that in India, people can see mountains in the distance that they didn't see for months or years because of the clearing of the atmosphere. So there are positive things that will come out of this.
I hope you're not saying nature's celebrating the fact that we're on the lockdown, but that's another story. Mr. Prime Minister?
Thanks. I just want to reflect quickly on some of the caller who spoke about this government-imposed lockdown, and he's fond of putting things in that way. It is that the government is working on the best of advice provided it, and having regard to experiences elsewhere. The World Health Organization, the CDC, PAHO, CARPA, all these are reputable institutions engaged in health and they are apolitical bodies, and they are concerned first and foremost about the health of the population. Their advice have helped us shape policy. We would wish that there was no curfew. The ideal situation is that every citizen and resident, having heard the warning, having seen and appreciating what is happening around the world, that everyone will do the right thing. But it is not likely that that will happen in the real world, given human own nature, given the diversity of views, as we hear. Some call or believe it's a conspiracy, so they want that. Some people believe that their God and my God will, by his stripe, heal everything suddenly, so they will not abide by it, as we saw in Antigua and we saw in Jamaica. And so you need then, that is where the state is. Part of the reason for a state is that you must have somebody, some entity to protect the nation and individuals from themselves and for the wider good of the public interest. That is why, for example, certain coercive powers are given only to the state to lock up people, the police, the defense force, arms of the states that are involved in doing certain activities to protect the wider public interest, or else each to his or her own would lead to confusion. And that is why we are doing these things. I would want to make the point that I am satisfied in my own mind that it is a multiplicity of things working together, self-reinforcing, that will help us. So you can't just do social distancing, but you're not going to wear the mask. You need them both. And you can't, so you're doing social distancing, but you're not building your immune system. That will not work either. So all the lessons that we have is a combination of things that we must do to the extent we reasonably can that would help us win the battle against the COVID. So I'm all for building the immune system, getting enough rest, improving your vitamin C, D, and E, and all others, all for the mask making. And an ancillary point, because it goes back to the economy. You see, we have maybe since 2007 developed the mantra, the health of the nation is the wealth of the nation. And therefore, what is happening from the health sector can't be divorced from what is happening in the economy. A functioning economy needs healthy people to be able to produce. And again, in that context, we must look not only at challenges, but opportunities. One of the lessons from this is that we have not done enough as a people for agriculture and for food security. So going forward, we have to do much better. So we have to invest more in our farmers, in our fishers, in our supports. Treat them as good or even better as we do the tourism industry. Thankfully, because we are open economy, there is no shortage of food. Every week, Milo Box will tell you, and Dan James will tell you, we have container loads and container loads coming with food and beverages. So we can rely on our foods being imported. We want to shift that, where most of what we eat and drink are produced here. This is an important lesson that we have to do more to feed ourselves. And I'm linking that with the notion of keeping people hopeful. I'm linking that people have to see a future that is more optimistic. I see, for example, that Sun Island Close will emerge with a new line in mask making, which will provide not only for St. Kitts and Nevis, but for the further islands in the Caribbean. Because again, the advice is anything that covers is better than nothing. And that is where we want to get people. Because the surgical masks and the N95, they are scarce in supply. So I want to commend again Lynette Bonaparte at New Road Housing. And I gather since we spoke about that, business has gone up. Maybe 1,000 full backers so maybe you might be able to get something for Winnipeg for
Thank
free
you, sir.
advertisement. And all the others, you'll be surprised, the people we are now doing it, give us a mention. St. Island Close is now producing close to 12,000 masks per week. And at that rate, if that continues, that becomes an export. Because we have over 50,000 people. It means within a month, more than enough is there since they are reusable for everyone. And we begin to look at getting into some of the other countries. So that is another avenue in which we can work. We have the horror story, and we don't know what that would lead to, but clearly shows that we have certain skills that are important to the health sector and importantly to the defense industries. How we capitalize on them to gain advantage, to create employment, and to improve our relationship with the United States of America and Europe are matters for future discussion. I think for me, I am by nature optimistic. I've been through so many struggles, and I know really once your mind can conceive it, it is important that you let your mind go to the limits. Clearly, we are a country where people have a strong, enduring faith. And in my message today, I try to see what have we learned from this Easter story, the good, the bad, and the beautiful things. The crucifixion, the adoration, then crucifixion, how men would fail at times, and yet we still see, even in the midst of what we may say on one hand was something disagreeable, something which we had a discomfort with Judas, we still say remorse, and we say all is not lost. We see the denial that came from the disciples, and yet in the end it was as if all of these were to prepare us and for us to understand the frailty of human nature, and that we have to have something higher. The higher thing in the end is our faith. The higher thing is that we must have a plan. And over the last 5 years, because we have planned, not knowing that there will be a COVID-19 mark but planned to ensure that the future of St. Kitts and Nevis was in the strongest possible position, we are now better able to make the kind of targeted interventions that put us in a best place to have a brighter future. We hope that future will be sooner rather than later. But in all of these things we have seen, with the COVID-19, things tend to get worse before it gets better. And that is why we are committed to the idea of flattening the curve, because the sooner we see it, then the sooner we can begin to build out. I take inspiration from Mandela's own life. 27 years locked away, and one would have thought all was lost. To come back to take charge of his country and to rule it with a strong sense of patriotism and love. Rule it in such a way that he had no wish for power after one term. He had set his country on the right path in, as it were, bringing people together, unifying people, reducing the fear between rival groups, so that in the end, when he stepped out of jail and he said the famous words in African language, which translate, free at last, free at last. As a result of Mandela's tenure, the people of South Africa could then sing that as their redemption song. A free people with free will, working tirelessly and resourcefully to build their nation, will always be ahead of those who are not committed, those who are not committed to seeing the country rise to abiding heights of glory. And because I am committed, and my cabinet is committed, and I see every day what Dr. Wilkinson, Dr. Laws, Dr. Liddy, Dr. Dolores Stapleton Harris, and all the other functionaries in health, Mr. Brandy, I know of their sacrifice, their longing to assist this country. I have every reason as a leader to feel proud that St. Kitts and Nevis will be the first in the Caribbean to defeat the COVID-19 and to begin to rise again. And then we are going to pool. In fact, we've already begun to contemplate. We will put in place a national recovery team, John, from across the island of St. Kitts and Nevis and the diaspora, to bring the best of talents again to help us rise as we must after the COVID-19 would have been defeated.
Thank you, Mr. Prime Minister. We go back to the phone lines. Call you live and on the air. Good afternoon.
Yes, good afternoon again. I work right in the tourism industry, most of the cruise, most specifically the cruise industry. So I follow the updates and the progress of the cruise line, right? And some of the cruise company are thinking about setting up business again sometime maybe so the mid of next month and to the end, right? If those companies are successful, Mr. Prime Minister, would St. Kitts and Nevis open up to them, or we would just continue the shutdown? And then there was a caller earlier who talked about who seemed to have some problem with the shutdown. Louisiana, the state of Louisiana in the U.S., right? They have a festival in February that they call Mardi Gras. Before that festival, Louisiana didn't have any known cases. After the festival, Louisiana had a outbreak. So I think some people should look at that and see where the shutdown might be a good thing for. Thank you.
And thank you very much for your contribution, sir. Much appreciated. I have a question coming in by WhatsApp. It begins with a comment, first of all, saying, and this question is for Dr. Wilkinson. I went to the WHO website. It stated on April 2nd that local transmission indicates locations where the source of infections within the reporting location. In situation report dated April 10th, there was no definition for local transmission. There is no cases, sporadic cases, cluster of cases, community transmission, and the definition of sporadic cases mentions importation or local detection. There are also disclaimers noting that each country defines transmissions differently. Are we being St. Kitts and Nevis, using the WHO definition in this regard? And the other question has to do with the bus drivers. Could the Prime Minister say something about public transportation when people have to move around? Their reports that some bus drivers are just ignoring people in some cases. And I'm not in any way casting aspersions on all the bus drivers. This is a question coming in saying some bus drivers are going past passengers and they're concerned, and perhaps there should be something that says off duty so they wouldn't feel discriminated against, especially the elderly and people who are differently abled. Dr. Wilkinson.
Okay. I don't want to get bogged down with semantics other than to say I mentioned that St. Kitts, we are at level 2, which means that we have sporadic cases, and these are countries that have 1 or 2 cases that were imported or locally detected. And when I say locally detected, it means that if somebody came in with the case and they were in close contact with someone and the virus was transferred from that person to the other one, then that is locally detected. And yes, that is local transmission. But when we are speaking about the different scenarios, when we have widespread local transmission, then that's where you get the clusters and the community spread. But we keep getting bogged down with these semantics. And the most important thing is the health measures that we put in place to put a cap on these things.
Thank you very much, Dr. Wilkinson. Before I go to the Prime Minister, let me add to the PM's burden by giving him 2 other questions. The other one has to do with basically, Mr. Prime Minister, how is technology helping us to handle the pandemic? I think you gave examples already, but if there's any more you'd like to add. And the question now of the young people, what ideas you have, are you in discussions about how to engage young people in perhaps offering solutions for what you may want to call the new day, in the context of the United Nations having a Code the Curve competition where young people are asked to submit their ideas for dealing with 3 things, essentially. 1, access to distance learning. 2, access information and data management, including how you battle misinformation and disinformation in the context of dissemination of information. And thirdly, addressing social health issues now and after. So the United Nations has invited young people, young hackers as they call them, I think, to submit, their suggestions as to post-pandemic, if you like, reality. And Mr. Prime Minister, as I do, that many young people, 8 and 9, already have PhDs in online training. They're actually training us now. It's a new normal, as some people are saying these days. So over to you, Mr. Prime Minister.
I want to thank the caller who raised the issue and the tension, really, between economics and health. And we had that conversation. It is the heart of a lot of the division in the USA now. Trump says open as soon as. Somebody else said, but you're imperiling people. And we know that unless the economy is healthy, you can't sustain health care. So the two go together. The health of the nation determines the wealth of the nation. And a wealthy nation must have healthy people. Economy that is working well need healthy workers to provide the production and productivity. So that is critical. So if the ships were to come, what will be the consideration? And we are taking on the risk of dealing in hypotheticals. The truth is, we don't know what next week would look like, both in terms of science, both in terms of knowledge. People are talking about test kits. The efficacy of test kits is in doubt. In some places, you're having people who very, very bright saying the opposite things in relation to them. So we are learning as experiences bring more things. More persons are using them. The outcomes are transparently determined. So we will see what the body of knowledge is. What our approach has been, though, for this initial period, health come first. Health come first. When we had the cruise ship here, I think the one which came with over 600 persons who had embarked in Italy, it was professional people, or it were the professionals. It was the professionals like Dr. Wilkinson, like Dr. C. Haley, like Dr. Liddy, like Dr. Laws, who came to the cabinet and helped us make that decision. And we were of the view, and I at least had always been, unless you could justify it, that it will bring no harm, unless we are sure it will bring no harm to our people, we shouldn't do it. The precautionary principle of healthcare, I think, is an important one. So if ships want to come, we will have to be assured from all the information that they will have to provide to the CMO and the healthcare workers that there is no risk that if they were to come on shore, that our people will be affected in any significant way. But as I said, the science is evolving. We are in uncharted waters, and perhaps by that time the vaccine will come. We don't know. Some say it's far off, some say it can be expedited. So we wait and we see what will happen there. But we want the economy to get moving again. That is a reality too. So we do the balancing. The question of the bus drivers, again, we are in an all of society approach. And this is calling for all of us to be at our best. And I understand as a citizen, which is what I am, and a national leader, which is what I am also, that there are times when our people will fall short. And again, I go back to the Easter message and all that led to that. People will fall short. But we have to try repeatedly to be at our very best, to develop habits, because the habits allow us almost an impulsive, natural response. The bus drivers now, less people for the issue of social distancing and physical spacing. From about 15, you're down to 4 or 5. So sometimes you may see them look like they're passing you, but they really can't take no more. And maybe they need some signs, as was the example that was given, not on duty, or we are up to our load, so that people could understand. And we will need, and I have signaled to the cabinet that we'll have a conversation with the leadership of the bus, so we can see buses where they're at and how we can, as it were, bring into better symmetry and congruence a working relationship that benefit the people. Sometimes when I hear persons say that persons can't get bus, it goes back to the question, why are they on the road? Why are they on the road when it is in the regulation? And Regulation 12 says that you must be at home to protect yourself from the corona. 3 categories of persons are allowed. And in the context of the law, they say you stay at home and you stay in your yard space and you avoid contact outside of your family. So home, you play with your children, you do whatever, you take them around, you bring up the old-time games that we used to do. Whether it is, whatever it is, you find them, and you do that with your family. Except you're an essential worker, and not just an essential worker, but you are required to work. That is when you're on the road. Your work is required to work under Regulation 6. And Regulation 6 says you're the hospital, medical facilities, security guard, etc., etc., or you get permission from the Commissioner of Police. Otherwise, where should you be? At home, in your shelter. And what we have are a number of persons continue to act as if it was how it used to be yesterday. And I keep making the point, challenging as it is for me and for all of us, in this new world order in which we are operating, a lot of the things we used to do, we can't do them no more until we have won the war against the COVID-19. That is why the other day I commended Police Officer Donnelly Shiverton, because I was at the ferry terminal, and ferry terminal was able to hear us say to some persons who shall remain nameless, you all cannot stay here in town. You have done your shopping, go home. You can't be down at the ferry terminal liming in the old accustomed way, because we are on the war. And when you're on the war, you must find a safe place. And we are here saying the safest place is for you to be at home, away from anyone. You will not get it from anyone outside the home, hopefully, and you will not give it to anyone, because you are staying at home. So that is one of the concerns I hear as we do all these things. And clearly this is pressure for the bus operators and for the traveling public, and we have to find a way. As part of the whole of society approach, this coronavirus is asking us to be our brothers and sisters' keeper. We need now to do more pooling. So our friends, each of us does not have to drive the vehicle to come to town. We are going to work, some of us, at the same institution. We have to leave work, given the curfew, at the same time. So let us share. Today I might use my vehicle. Tomorrow you use yours. That reduces the number of vehicles on the road, the pollution, the congestion, the long lines of people having to walk long distances to get their vehicle. So again, pooling of the resources, and I will advise better planning of your trips. In the good old days, we get up any day, we know we are going to reach Mass there. Under curfew, that kind of flexibility cannot obtain. The technology has always been said to be the new wave of the present and the future. And I marvel that the world after COVID-19 will be significantly transformed. The regulation itself in relation to the emergency power says that people, all businesses and offices may continue their business operations by allowing their employees to work remotely from home utilizing virtual means. That is how you should be working. From home, if you need to work. And indeed, therefore, it means that more of our people will have to get up to speed in relation to the technology, because businesses in recruiting people will want somebody with some know-how in relation to ICTs. So that is the new wave. And because the young people are by and large at the forefront of the technology, they will have the best opportunity and the best chance to lead that way in terms of employment. And indeed, I want to commend our Accountant General's office, because this week we're able to bring forward the payment to our GAE workers and our STEP workers. Over 5,000 employees will be able to receive their payment within 24 hours. We're able to move from what would have been Thursday to allow those who had to work on Wednesday to receive that. When I contacted the Accountant General, he said, "We're online, Prime Minister. If they get this to us today, it can be done." Again, I want to commend these unsung heroes who are there everywhere. Young people certainly have been showing exciting leadership. I think in Anguilla, one of their Calypsonians had come on board to sing about the virus and the seriousness and what people can do. I think it was EK and Freedom speaking very well regarding the dangers, regarding the fact that people in this new season, everyone has to try to stop waste time in supermarkets, get in quickly, get back out as quickly as you can, shop with a list. Done away with the habit of going Wednesday, going back to shop Thursday. It's not necessary, really. And again, we have to show greater resourcefulness. And we certainly want our young people everywhere to bring their skills, imagination, and creativity to help us build a beautiful St. Kitts and Nevis. And there is space for them. In their music, for example, now, they could bring to the fore powerful lyrics that help the peace of mind and inspire their peers and all of us to a greater element of service. So I want to say that there are ample opportunities, and while this is a challenging time, the future belongs to those who right now are seeing the opportunities. And so I would want to encourage the young people. They may be quote-unquote part of the young hackers movement, to begin to see their niche, to begin to see where the dust may settle, and where out of the ashes of COVID-19 we will rise again to a higher level of patriotism, of service, of resourcefulness, and ingenuity as a people of St. Kitts and Nevis.
Well, Prime Minister, I want to thank you very much. We are almost out of time, but not before we invite parting comments from Dr. Wilkinson and yourself. We'll begin with Dr. Wilkinson first. And of course, I always like to end this program by asking if you see any opportunities in the crisis, because there's an old adage that says every crisis has opportunities. And I don't know whether it's technological or otherwise, but if in your wrap, I know you already know what you would like to leave as your parting message. If you want to add perhaps something you've noticed, something you've seen as an opportunity, because life has to go on within the crisis and after the crisis. Mm-hmm. So with those few words, I'd like to invite final comments from Dr. Wilkinson.
Well, I'm actually going to be very short with my comments, because I just want to say that if we're going to be successful in fighting this war, in fighting this virus, we need the assistance of everyone. And persons are going to have to make personal sacrifice for us to get through this. Ever so often at some of the press conferences, we hear people calling in about the inconvenience of having to stand in the line, the inconvenience of having to wait for Wednesday or Thursday to go shopping. And we have to understand that we have to tighten our belts and we have to make sacrifices for us to get through this. And we also have to take on what's called personal responsibility, even as it relates to shopping, because I go from time to time and I sit in the parking lot and I look and see what's going on. Sometimes I go into the supermarkets and you will see people standing out there for hours in the line. But once they get inside, they forget about the persons who are outside. And so they're on their phones, they're moving around, lazing around, etc., taking their time shopping. When you're going to shop, you should have it as a purpose. You have your shopping list, you go in there, and you have yourself on a timer so that you pick up what you need, and then you get out. This is not going to be forever, and that's why I say it's a personal sacrifice. This is not the time for you to do value shopping also. There are still some persons who go in the line at Value Mart, but then they go to Rams to buy their grapes, etc. And you need to be able to shop in one place, be it at your community outlet, in the country, if you live in the country, if you live in Frigate Bay, if you live in Bird Rock. There's no reason for you to be moving from place to place. So I want everyone to exercise this personal responsibility, because if we can contain this virus within 2 incubation periods, we should be on the path to recovery. And the sooner we can get our country back together, the better it is for all of us.
I want to thank you very much, Medical Chief of Staff, Dr. Cameron Wilkinson, for being here today and for sharing your thoughts with us and your expertise. And we, once again, would like to compliment you and your team for the hard work you're doing. And, of course, we wish you well. Mr. Prime Minister, I have to add, again, I'd like to add something to you, even as Mr. Wilkinson, Dr. Wilkinson was speaking, and Mr. Kahap could work as a surgeons are called Mr., right? Sometimes?
Yes.
Surgeons are called Mr.?
In the UK.
So my mistake gets away a little bit. Anyway. So let me get back on track. As Dr. Wilkinson was speaking about shopping in your areas and all that, something came through as well, asking a question about restocking some of the smaller businesses, because they have to depend on the larger businesses. So when the shelves run out, even when you open back again for that particular time, they still have to wait to get some stuff. And I want to know whether you're looking at that as well. And I can't speak for you, Mr. Prime Minister, so it's over to you and your parting comments to our listeners.
Thank you very much, Mr. Bacchus. And you were going on a good track. Sometimes a leader should not speak because the people know it, And yes, I have been looking at the challenges that are faced by the retail outlets in the country area. I have spoken to Mr. Western at Rams, who is the largest wholesaler in the country, and we've been having conversation with Mr. Samuel at the NEOC with a view for dialogue with the chamber to ensure that we have congruence in the message that we want people to do what Dr. Wilkinson is saying for the time being, to avoid going to multiple places as if we are in the same old world and we are just transferring these things for today. The old order must be banished from your mind during this fight, this war on COVID-19. This idea that I am shopping at 3 supermarkets should be outlawed without any lobbying pass for that. You yourself should come to the appreciation and understanding, using your own common sense. The more I am going from supermarket to supermarkets, interacting with hundreds, maybe thousands of people, the greater the probability or risk that I can become infected. And the only way to minimize it is to reduce the number of persons with whom we are coming into contact. Online shopping, we want the supermarkets to get there in an anxious way, in other words, quickly, because that also helps to reduce the number of persons who are having to go to the supermarket. So I want all the wholesalers to be able to do. How we are going to give them support is a logistic matter. I've now put in the hands of Mr. Brandy and his team and also the NEOC. So we are hoping that by the time one makes another address, that matter would be sufficiently handled, because we need not only the supermarkets to be replenished and restocked, we need the retailers. And some of the retailers are saying, frankly, that some of the wholesalers who are double dipping, that is, being wholesalers and retailers, are not showing enough enthusiasm to get the supplies to them. The suppliers, on the other hand, wholesalers may say, well, we have the limited time, and so we have to devote the resources to our supermarkets. So we are going to try to work it out in a sensible way in the earliest possible time. So I'm saying, in the meanwhile, keep faith alive. My closing remarks will be two quick things. One, the theme I've been developing, the power lies in you. The power lies in you, my fellow citizens and residents of St. Kitts and Nevis, to make this experience a life-transforming one that will advance your chance to, as it were, rise from this, our season of grief, to a new era of happiness and gain by doing the things, simple things you have been asked of you. Simple things on which you will make the occasional mistake, and don't kill yourself over it. It is the practice, the habit, which all of us are now attempting to inculcate. And we will have our shortfalls, but it is to pull ourselves up when we would have fallen short, recognize we did what we should not have done, and to get the renewed energy not to repeat it. And again, perhaps we may wax a little biblical. My Father, how many times must I forgive him? Is it 7 times? And the answer was no, not 7 times, 70 times 7. And all I said that to say, even as we are urging you and encouraging you, I want you to work hard. You will not get it perfect 100% of the time as just starting out. But try as quickly as possible to get to that 100%. Wash your hands frequently. So simple to do. The power lies in you. Do that at home. You get up from your chair, wash your hands. You just finish eating, wash your hands. You're outside with your baby or with somebody, wash your hands. Do it as frequently as possible. Avoid touching your face. Hard to do. You have to get accustomed to say, I can't put my hand there. But it's the practice I want you to do. If you cough, you do so in a tissue and dispose of it immediately. If you don't have a tissue, you do it in the bent elbow. Again, a new mode of operating, but the power lies within you. These things are not too difficult. It will take time, yes, to perfect them, but I want you to try. I want you, when the police comes and you're in Lodge, or Keon, or Old Road, Tabernacle Phillips, you name them, St. Paul's, you all are too close not to engage in abuse. Just try to find 6 feet and you keep it safe. When you are playing again and you're under the tree, I see that people climbing the same old way. Try as much as possible to keep some distance and look after yourself. My final word will be to the people of St. Kitts and Nevis. Now is the time to rally with your country. For your country is under war. A war made more challenging by the fact that the enemy, a microorganism, can't be seen by our human eye. And yet it is attacking us. It is attacking our friends. It is attacking our family members. It is attacking our co-workers. And that is why we say we need an all of society, everybody playing their role. Power lies in you. Our flag, our coat of arms, and all our national emblems become more significant. You have to show greater allegiance, obedience to this country of St. Kitts and Nevis. For this now is truly our shelter, our spot. We are locked in here. No plane will come to take us out easily. No cruise ship will come to take us on a ride elsewhere. All we have is St. Kitts and Nevis. Let us do for it what at no other point we are commanded to do. Give it our best shot. We have to avoid the nitpicking, as it were, from time to time. And every advice that is put forward, somebody want to do a double check, a fact checking of things which are simple and which have to be followed upon. I want to say pray. Pray to God that we get over this pandemic as quickly as possible. This is a time for us to recognize that we can't put the health of the country below the politics. Our coat of arms, and that is why I spoke to the national emblems. Our coat of arms, our motto, country above self. For this time being, let's forget the political party. Let's do what we can, because the life we will save may be our very own. And that is the challenge. When people are looking for brinksmanship, when people are looking for some form of attention or to prove a point, to undermine the health sector, it will not work. More than ever, we have to appreciate the ex-Nettleford point. All we have is us. We have to work together. Whatever our political divide, the virus knows no party, no class, no geography, no region. All of us then have to be united to be able to win the battle. The government processes are welcome. Welcome in. All who want to be a part, I extend the invitation for you to reach out to the relevant authority, because we don't have all the answers, but we have a duty as the government to do the best that we can do for our country. If you want to be part of those who are engaged in health planning, reach out to the Chief Medical Officer, Dr. Hazel Laws. She's the best that we have had for almost a century. And she's very, amicable. She's just a gem. So if you want to make a contribution, that we do. If you want to contribute to the work of the National Emergency Operations Center, please volunteer with Mr. Abdias. There will be a room for everyone to be able to make their contribution. If you want to help us to refine the statutory rules and orders, we are open. So each one of these, if you look at these SRO, each time they come out, there's some changes in them. And that is because we have been receptive to feedback. And we have been, as it were, welcoming constructive advice from people about how we can do the best for St. Kitts and Nevis. It has been a challenge for me, but I see it as a great opportunity that the people of St. Kitts and Nevis allowed me, the son of a poor woman of St. Kitts and a poor father from Cotton Ground, Nevis, to rise to become the third Prime Minister and to lead this country at this time of challenge, such a time like this. I will always see it as an honor and a privilege, and I will work even harder to fulfill the reasonable expectations of our people. St. Kitts and Nevis will emerge stronger, healthier, and safer if we work together. This too, this pandemic, will pass, and we will rise again. May God bless the people of St. Kitts and Nevis, this country that I love. Thank you, Mr. Bakker.
And thank you very much, Prime Minister Dr. Timothy Harris, for your presence in the program, your willingness to engage and to take questions from the public. And of course, we wish you well, sir, and your team as you continue your fight against the pandemic COVID-19. Again, Dr. Wilkinson, good afternoon. Prime Minister, good afternoon.
Good afternoon.
Let me say good afternoon to all our colleague stations as well who are part of the broadcast, reminding our listeners that at 5 o'clock this afternoon there's going to be another briefing from the National Emergency Center, as well as each and every day. And of course, you can tune into most of the radio stations in St. Kitts online as well to get the very latest information from the National Emergency Operations Center. Thank you so much for your time. Thanks to Trent Sargent for his excellent work in the technical capacity.